Hey guys, it's Sarah here. In this video, I'm going to be going over all the medication that you have to know for the NCLEX. So just before I start, I just want to let you know that everything I'm going to be saying today is available in a PDF form at my website. You can look at the link below or just go to Sarah with an H, so SARAHRN.com. So let's get started. So first we're going to start with a GI medication. Over here is going to be the classes, and then I'm going to say information about it. The first class of GI medication that we're going to go over is the PPI. PPI stands for proton pump inhibitor. They all end in the word prazole, so omeprazole, pantoprazole, etc. And what these do is that they reduce the acid in the stomach. When they do this, there's also a risk that they decrease the calcium absorption. So whenever you think of calcium, you want to think of like osteoporosis, breaking bones, falling. If you have too little calcium and too much calcium, the opposite. Because calcium is good for your bones and stuff like that. So if someone's going to be on a proton pump inhibitor for a long time, they're going to have the risk of decreased calcium absorption. So like osteoporosis is something you want to think of. There are risks for fractures, etc. You also want to tell them to take it before their meals. And the reason for that is because it's reducing acid production in the stomach. So before you eat something that's going to cause acid production, you want to help that it will come in effect and reduce it. The next type of GI medication is H2 receptor blockers. So these end in, see like famotidine, they end in tidine. Famotidine is the most common, which is Pepcid. Basically, what they do is they block the H2 receptor and ultimately they block the acid production. So like PPIs, they reduce acid production, this is blocking acid production. They're both used for the same thing, pretty much. The next type of GI medication we're going to be talking about is antacids. So what antacids do is that they neutralize the acid in the stomach and they're used for stomach ulcers. So examples of this is milk of magnesium, aluminum hydroxide, sodium bicarbonate. Okay. Okay, so now we go on to laxatives. So laxative, as you probably know, they're used to relieve constipation. There are many different types of laxatives. So we have the fiber supplements, which includes psyllium. What those are is that basically they make the stool bulkier, so it helps them move along. You have the stool softeners like doxusate, which is colchicate. So doxusate is basically, it's bringing the water into the stool. And the way I like to remember this is like so doxusate. So like you go to the doctor when you're constipated, and it's going to bring the water into the stool, so help it pass easily. The next type of laxatives are the osmotic agents. So you have the Maralex, which is the polyethyl glycol, very common, and the milk of magnesium. It's basically the same type of thing. It causes the water to be retained with the stool, so it's bulky and it moves forward. You also have the lubricants, which is mineral oil enemas. You have the stimulants, which is bisacodyl. That basically they stimulate the intestines to contract, so it will move the stools along. What you want to know is that you don't want to give laxatives to anyone with fecal impaction, because if there's an impaction there and you're going to try to get it to move and push, that's going to be bad. You also want to know that with laxatives, so when you're having a lot of stool come out and water come out, there's a lot of times there's a fluid and electrolyte imbalance. So you want to watch out for that and dehydration and stuff like that. The next type of GI medication is antidiarrheals. So the main one is loperamide, which is Imodium. The same type of thing as a laxative, there's a side effect for fluid and electrolyte imbalance. So you don't want to use this for more than 2 days because you don't want to have them keep going. They're not going to be drinking enough and you're going to have dehydration and other stuff. So here's a question. Your patient has been taking omeprazole for 6 weeks. So remember we said prazole is a PPI. So as a nurse, you realize that the medication is working if the patient reports the absence of which symptom. So basically, what is omeprazole supposed to be helping? Diarrhea, flatulence, constipation, or heartburn. So I'll give you a minute to figure it out. So the answer is number 4. It's a PPI that's used to reduce acid in the stomach. So it helps with like heartburns, acid reflux, etc. Okay, some more medication for GI is Antiemetics. So these are basically, they help with vomiting, nausea. The main one that people prescribe is ondansetron, which is Zofran, that I would know. Some other ones are promethazine. The thing you want to know about this is that it could cause CNS depression, so it's not so much prescribed. Scopolamine, this is actually a patch. It's put on hairless, clean, dry skin, usually behind the ear, usually before the person travels so they don't get nauseous and vomiting on sea, cruises, etc. You want to replace it every 72 hours. The last type is metoclopramide, which is Reglan. This is also used, it promotes, like it helps the stomach, and it's used for an antiemetic. Some other GI medications that I would just know that I can't really put under a specific category is sucralfate. Sucralfate is also known as carafate. It's don't give it with other medications. That's what you should know for that. A different type of medication is misoprostol. What I would know for that is that it's actually used to treat stomach ulcers, but the main thing you want to know is not used in pregnancy. It's actually used in pregnancy to get away at pregnancy, like to, like abort the pregnancy. So you don't want to use this if someone's pregnant. The next one is simethicone. That's a gas drop. It's used to relieve gas. A lot of times it's used in babies, colicky babies, etc. The last type is octreotide, which is used for GI bleed. Okay, so now we go on to antipsychotics. So these are used to treat all different types of stuff like schizophrenia, delusional disorders, psychosis, etc. There are 2 different types. You have the typical and the atypical. The typical are the ones used while they've been here for a while. Haloperidol is the main one, which is also known as Haldol. And the other ones are listed over here. The thing you want to know about the typical is that the main symptoms they're going to ask you about is neuromalignant syndrome and extrapyramidal symptoms. Those are stuff that could be caused by typical antipsychotics. The atypical could also cause this, but at a much lower rate. What the atypical causes for the main part is weight gain and diabetes. So when you think of typical, think of the extrapyramidal symptom, which is considered EPS, in the neuromalignant syndrome, and for atypical, think of diabetes, weight gain, etc. Atypical ones, what I would know about all these is clozapine also. So clozapine, the main thing you want to know is that it has a huge side effect of agranulocytosis. So they're at risk for infection, so you want to check their white blood cell count, you want to do CBC, etc., and monitor them for any signs of infection. One other one not listed here is ziprasidone, which has a risk for QT. So just think ziprasidone, cardiac, don't give it to a cardiac patient or someone who has a prolonged QT. Okay, a question. Which laboratory study would a nurse specifically monitor for a patient on clozapine? Platelet count, white blood count, BUN, cholesterol level. So, like we said before, clozapine could cause agranulocytosis. So you want to check the white blood cell count before starting the treatment and while it's in use. And report any fever, sore throat, any signs of infection. Okay, so now we go on to antidepressants and mood medications. So with antidepressants, the main thing you want to watch out over here for is that you want to monitor for worsening depression and suicidal thoughts, because it takes a little bit of time for the medication to work. So someone could be on an antidepressant and then it doesn't help after day 3 and then they get worse or they have suicidal thoughts. So you really want to watch out for them for the first few weeks for suicide. Antidepressants are one of the medications that you do not want to mix with each other. So you need a washout period between them. So you don't want to all of a sudden be taking one class of antidepressants, switch to another one because it doesn't work. You need a washout period in between. There are different classes. So MAOIs, the main thing you want to know about them is the foods. Like MAOIs include the medication phenelazine, isocarboxide, paroxetine. But the thing about this is you cannot have tyramine food. So foods high in tyramine could be aged cheese, like wine, stuff like that. And it could cause a hypertensive crisis if you do. So no tyramine high foods, and you need a washout period between it. Like I said before, 2 weeks between switching classes. The next class of medication is atypical antidepressants, which the main one is Wellbutrin, which is bupropion. There's nothing really necessarily for that. The next type of medication is TCA, so tricyclic antidepressants. So these are easy because they end in triptyline. So just think trip, TCAs. The one thing you want to watch out for this is the cardiac. They have a cardiac risk. So when I'm giving you the hints, so let's say you have a question and it has a TCA and in the answer has like a cardiac or cardiac, you want to just click on that. The next class of medications are the SSRIs or SNRIs, so selective serotonin reuptake inhibitors. So this includes citalopram, they all end on like pram or paroxetine, so teen or pram. Like I said before, it takes a few weeks to see the full effect. You do not want to take these with St. John's wort, so know that, no St. John's wort with them. The main thing you want to watch out for is the serotonin syndrome. So this is when the body has too much serotonin and it goes into serotonin syndrome, which could be like they have a mental status change, they get really hot, diaphoretic, tachycardic, and start like tremoring. That's your typical serotonin syndrome. So let me just go over this really quickly. Basically, antidepressants, risk of suicide, don't take them, you need a 2-week washout period between them. MAOIs, you want to think of high tyramine food, don't take it with it. Atypical antidepressants, just know Wellbutrin, bupropion. TCAs, which is tricyclic antidepressants, think of your so tricyclic antidepressant, they end in triptyline. And think of cardiac, they have a cardiac risk. SSRIs, think of serotonin syndrome, you have too much serotonin, it causes you to be tremors, sweating, mental status change. So you want to watch out for that. So if you have a patient on SSRI and they have any of those symptoms, you want to automatically think serotonin syndrome. Stop the medication. And also don't take it with St. John's wort. A medication for mood that helps with mood, like bipolar and stuff like that, is lithium. So the thing about lithium is that you want to know is, number 1, it affects the kidney, so you want to check those levels. Number 2, you need to have a lot of fluid and sodium with lithium. And number 3, it's a very therapeutic range, so 0.6 to 1.2. Usually any medication that has a very narrow therapeutic range, you're going to be having blood drawn because you need to see if they're too high or too little. If someone has toxicity, like too much, then they have GI effects and neuro effects. And the risks for getting these, I think of like DDD. So dehydration, diet low in sodium, decreased renal function, and drug-to-drug interaction. So that's why I said fluids and sodium are crucial when patients on lithium. ADHD medications. So to use, I actually think it's like funny that ADHD, when someone's like so hyper, you can use like a stimulant, which is like so hyper. And that's why I always remember that stimulants are used for ADHD, because it's like the opposite of what you would think. They usually end in amphetamine, so dextroamphetamine, etc. For this, you want to monitor for abuse. A lot of times they're abused, they make someone feel better, and don't discontinue abruptly. You gotta like taper them off. There's also a risk for growth and developmental, like stopping it. So if you have a young person or a teenager on it, you want to monitor their weight and height at each checkup. If someone cannot be on a stimulant, and they have ADHD, then you want to put them on Atomexine. Sorry if I'm not pronouncing them right, but that medication is a non-stimulant used for ADHD. Okay, now we go on to anti-anxieties. So the medications that work for anxiety are benzodiazepines, which are also known as like benzos. They usually end in pram or lam. So think of midazolam, lorazepam, pam, or lam. And the way I remember this is because Pam or lamb, just think of like a lamb, like bloggy, just sitting there doing nothing. So basically, benzodiazepines suppress the CNS, so they affect your CNS and they suppress them. There's an abuse. A lot of times they're abused. People overdose on them, and they have withdrawal symptoms if they stop them abruptly. So never stop them abruptly. If someone goes into they overdose in it, you want to give them flumazenil right here. This is something that I would know. The reversal agent for benzodiazepines, because they cause a CNS depression, so if they have too much and then they're depressing it too much, is flumazenil. If you want to put someone on an anti-anxiety medication without affecting their CNS, it's buspirone. Some other medications that are used for anxiety, duloxetine, venlafaxine. Okay, a question. A patient is receiving diazepam. So remember PAM, so that has to do with benzodiazepines. Which of the following would indicate a patient is having a side effect related to this medication? Headache, urinary frequency, drowsiness, or increased salivation? Drowsiness. So like I said, it depresses the CNS, so it would be drowsiness. Okay, anticonvulsions. Anticonvulsions are given to treat seizures and to prevent seizures. So ECT, electroconvulsion therapy, is actually used to induce a seizure. So if your patient is having it, don't give them anticonvulsions because it's going to ruin the whole test. They depress the CNS also, so you want to watch out for those symptoms. And they could trigger Stevens-Johnson syndrome. Anything that depresses the CNS, like the benzodiazepines or the anticonvulsions, you want to not have them operate heavy machinery or like driving cars or something like that because they have a depression of their CNS. Examples of these are phenytoin. Phenytoin specifically, you want to watch out for gingival hypertrophy. It also has a very therapeutic range between 10 and 20, so you have to do blood tests for that, and it causes liver damage. Other medications for anticonvulsions are carbamazepine. For that, you want to watch out for the agranulocytosis. Like we said before, the medication I said before was clozapine, which is also causes agranulocytosis. And valproic acid is also an anticonvulsant, and it's not used in pregnancy. Okay, so now we go into pain relievers. Pain relievers are different categories. So number one is opioids. Opioids are pain relievers that people abuse a lot of times. So a lot of doctors don't like to prescribe them, but they work better than an NSAID. So it goes case by case. Number one, they depress the respiratory center. They love to ask this. So any opioid they give you, and in the question it says respirations, respiratory center, something like that, it's that. You always want to watch the respiratory center respirations afterwards. Do not use someone with compromise, with like COPD. You have a reversal because someone overdose, which there is a lot of potential for abuse because people abuse them, they overdose. You give naloxone. And some examples of opioids are morphine, fentanyl, codeine, hydrocodone. Fentanyl specifically is usually given on a patch. And when it's given in a patch, it's called Diuretics. You want to replace the patch, like all patches, replace it every 72 hours. Don't cut it. You want to put it in a special place after. You're not going to just throw it out in the garbage because someone could actually take it out and like suck on it or whatever the heck people do. So like I said, you want to dispose it correctly. The next type of medication class used to relieve pain is NSAIDs, non-steroidal anti-inflammatory medications. So for these, you want to monitor for bleeding and GI effects. So avoid them in patients who are at risk for falls or someone with low platelets because they're at risk for bleeding, and you don't want them to have a brain bleed just because they were on an NSAID. All NSAIDs could cause GI toxicity, so you want to monitor for like black tarry stool, upset stomach, etc. And you want to avoid them in the third trimester of pregnancy because just avoid them in pregnancy altogether because in first and second trimester of pregnancy, they're not good either. So avoid them in pregnancy. So in pregnancy, if they're in pain, you want to give them Tylenol, not like an NSAID. Some examples of NSAIDs are naproxen, ibuprofen, aspirin, ketorolac, etc. One NSAID I would know that has a black box warning is celecoxib. It has a black box warning for increasing the risk of heart complications. NSAIDs are also used besides for pain, for inflammation and fever. Neuropathic pain relievers are gabapentin, which is actually also used for seizures. Okay, here's a question. So ibuprofen, Advil, is prescribed for a patient. The nurse tells the patient to take the medication A, with 8 ounces of milk, B, at bedtime, C, 60 minutes before breakfast, and D, in the morning. So let's give you some time. So the answer is 1, with 8 ounces of milk or food, because basically, like we said before, it has GI effects and you want to prevent GI irritation. Okay, next we go on to respiratory medication. So these are stuff for your lungs, coughing, etc. So antitussive is medication used to suppress cough, which is actually used from the CNS. It suppresses cough from the CNS. Anything from CNS suppressant, you want to watch out for abuse. So this includes codeine, and dextromethorphan. The next class is expectorants, which thins mucus in the airways. And this is guanfacine, which is Robitussin. There's also mucolytis, which is basically the same thing, but instead of thinning mucus in the airway, it thins it in the lungs. This is acetylcysteine. Okay, asthma medications. So For asthma medications, for asthma patients, first of all, you want oxygen saturation to be above 92 the least, and you don't want to give them any NSAIDs or beta blockers. You have your short-acting asthma medication, so if someone's having an asthmatic attack, you have your long-acting to prevent asthma attacks. Short-acting, so the bronchodilators for that are albuterol is the main one. Side effects include tremors, palpitations, tachycardia, and hypokalemia. You want to use it with inhaled corticosteroids, but remember, if you're inhaling corticosteroids, they could cause oral thrush. So you want to rinse out your mouth after, and the inhaler, etc. Long-term asthma medications for the bronchodilators are salmeterol. This is also given with a steroid for long-term use. Like we said before, you want to wash it out so there's no oral thrush. Okay, now we go on to antibiotics. So with all antibiotics, before I go into the classes, this is just a general all antibiotics, you want to watch out for gut health. Number one, they all could ruin the GI gut health. So they could have GI effects. Diarrhea is very common. C. diff. Do not take them with alcohol. And they have different prefixes and suffix which help you be able to see like which class and which antibiotic to use. Okay, so now we go on to antibiotics specifically. So as you see, in the big letters are the classes, and under that is just a few key points that you should know about them. Antibiotics, we're going to start with macrolides. So macrolides end in thromycin. So azithromycin is one popular one everyone knows, clarithromycin. What you want to know about the macrolides is that they could prolong the QT interval. So think of like doing an EKG, monitoring the person for cardiac stuff, etc. They're also hepatotoxic. They cause damage to the liver. The next class is aminoglycosides. Aminoglycosides end in mycin, either with a Y or I, but mycin, streptomycin, gentamicin, etc. These have a risk for ototoxicity, so think like ringing in the ear, and nephrotoxicity. So you want to monitor their levels, you want to do blood work, and watch for the side effects. So ringing in the ear, vertigo, etc. The next class of antibiotics are cephalosporin. They start with, so this one's start instead of ending. These start with ceph. So ceftriaxone, cefalozin. The only thing you want to know about the cephalosporins are that they have a cross sensitivity to penicillin. So if someone's allergic to penicillin medications, don't give them cephalosporin. The next class of medication is quinolones. These end in flaxin. So ciprofloxacin, levofloxacin are examples of this. All I would know for this is that they have a risk for tendon rupture. They have like a black box warning for that actually. So if there's like a sign of tendon, pain, or swelling, you want to stop the medication. The next class of medications are tetracycline. They end in cycline, so that's easy, tetracycline, cycline. These ones, example, doxycycline, tetracycline, minocycline. You do not want to have them in pregnancy, that's a big one. And you want to avoid sun exposure because they have a side effect of photosensitivity. The next class of medications are penicillin, they end in cillin. So these are really easy if you just know the class, just know it's very easy to pair the medication because penicillin, amoxicillin, cillin, just under the class of penicillin. So these ones that have a hypersensitivity, people are allergic to them. You want to watch out for that. Next class of medications are the sulfonamides. The sulfonamides include Bactrim, which is actually a combination of two of them, tryptophan and sulfamethazole. So it's just known as Bactrim. And that's the main one under there. Don't use this in pregnancy either. So in pregnancy, just keep in mind that a lot of antibiotics are not used. Other antibiotics include Flagyl, which is metronidazole. Side effects for that is metallic taste in the mouth, GI effects like all antibiotics, and don't take this with alcohol. Another antibiotic is vancomycin, which is used for like severe C. diff or MRSA. You want to monitor the kidney levels with that. They have a very therapeutic range, like 10 to 20, and watch for toxicity for like nephrotoxicity symptoms. And also could cause ototoxicity. Okay, now we have a question. So, gentamicin is prescribed for a patient with a bacterial infection. The patient is instructed to contact the provider immediately if what occurs: nausea, vomiting, hair loss, or muscle aches. So think of which class of drugs, of antibiotics, the gentamicin is under. So I'll give you a hint, it's under aminoglycoside. So which one is the side effect you want to watch out for? So it's the ototoxicity, so the hearing loss. Okay, now we go on to antimalarial and antifungal. Antimalarial are used to treat malaria, which is like a mosquito-borne disease. The main one under here is hydroxychloroquine. Side effects for this is it damages their eyes. So you want to have them have yearly or every 6-month eye exams and watch for that. The next class of medication is antifungal. So remember, antibiotics don't treat viruses, they don't treat fungal infections, they treat bacterial infections. So these are antifungal, which means they have a fungal infection. Fluconazole and nystatin are very common. Nystatin, like just think of, baby diaper cream, which is a lot of times used for that. So now we go on to antituberculosis medications. All these medications are hepatotoxic, so think of liver damage. If you see any signs of liver damage like dark-colored urine, jaundice, fatigue, anorexia, you want to think of that and stop the medication. You want to do baseline lab tests every so often to see, and don't give them with alcohol because alcohol is also damage to the liver. Some examples of antituberculosis medication are rifampin. So rifampin is given for active TB, and isoniazid is given for latent TB. Rifampin, you want to know that it could discolor the urine, or really any fluids like tears or sweat or anything, it can make them orange, red color. So you want to tell this to them before they freak out. You also want to tell them to wear eyeglasses, not contacts, and to use non-hormonal birth control because it could decrease the effectiveness of contraceptives. Isoniazid, like I said, is used for latent TB. Side effects for that is worth knowing is peripheral neuropathy. So if you see signs of numbness, tingling, you want to think of that. To prevent that, you could take vitamin B6. Then we go on to antivirals. Like I said before, they're used to treat viral infections. So usually viral infections are not really treated. They're usually like watch and wait, symptomatic treatment like Tylenol for fever, pain medication. But usually there's no like medication to treat them really. But there are antivirals that are used to treat certain virals. So you're not talking about your regular flu or a virus. You're talking about herpes, HIV. Those are viruses that these ones are used for. And what I would know is that they all end in vir, and for HIV, you can't cure it. It's only to help it not cure. There's no cure for HIV. Okay, alcohol and smoking cessation drugs. So as the name says, these medications help people stop smoking and help people stop drinking alcohol. So nicotine actually helps people stop smoking. It comes in all different type of forms. Patches, gums, inhalers, like candy type of thing, all different type of forms. The other type of medication that help people stop smoking is varenicline. This has a side effect of neuropsychotics. So depression, suicidal thoughts, stuff like that. Medication that helps people stop drinking alcohol, the big one is disulfiram. what this does is actually an aversion therapy. So when people drink it gives you really bad side effects that they never want to drink again. The one key is you have to watch out that anything that contains alcohol could cause these effects. So people don't think of these stuff, but the creams, lotions, all these different stuff like cologne, mouthwashes, sauces, vinegar, stuff like that could contain a little bit of alcohol and it could cause a reaction. So you want to have them educated, you want to tell them too much is very fatal, and they have to sign consent. Okay, cardiac medications. These are big ones because tons of people are on cardiac medications. You have different classes of antihypertensives. A lot of people have hypertension, and these are different classes. Number one is ACE inhibitors. ACE inhibitor stands for angiotensin converting enzyme. These all end in pril. Lisinopril, captopril, enalapril, pril. What they do is that they block angiotensin 1 from converting angiotensin 2. The side effects you want to watch out for this one, the main ones I'll just tell you, are hyperkalemia, so too much potassium, and angioedema, which is an emergency because it could obstruct. You don't want them taking this in pregnancy, and you want to know another main side effect is cough. With any antihypertensives, almost every single one could cause the opposite. So if you're trying to lower the blood pressure, it could cause someone to go hypotensive. So I'm not going to say for each one that could cause orthostatic hypertension, because that's for any antihypertensive. Too much of something, if you're trying to lower it, could cause the opposite to occur. So like I said before, monitor potassium, persistent cough, and angioedema. If someone has a cough and they want to, it's like a dry hacking cough and they want to get rid of it, they usually switch them to ARB. ARB is angiotensin 2 receptor blocker, and then sartan, so losartan, valsartan. They have the same side effects as the ACE inhibitors, but they have no cough. So that's why they'll switch them. CCB, calcium channel blockers, they end in dipine, so nicardipine, amlodipine, they all end in dipine. Side effects for that you want to watch out for are peripheral edema. So think of swollen extremities. Don't take them with grapefruit juice also. The next one is the beta blockers. These end in ol. So metoprolol, atenolol, propranolol, they have selective and non-selective. Selective only works on beta 1, and non-selective works on beta 2 also. So propranolol works on beta 2. Beta 1 is for the heart, because then there's one heart. Beta 2 is for the lungs. There's 2 lungs. So if it affects the lungs, you're going to have side effects for that, and you don't want to give it to anyone with lung problems, like asthmatic or respiratory problems. This has a side effect of bradycardia, because it affects the heart rate also. One type of beta blocker is actually used for the eye. It's timolol, and it's used for the eye to treat high pressure in the eye, like glaucoma. And last but not least, vasodilators. So they dilate, so they cause the blood pressure to be less high by dilating, and it could flow easier. And the main one under here is nitroglyceride, nitro, anything that starts in nitro. What you want to know about for the nitro is do not take them with erectile dysfunction medications, because those also vasodilate, and you're going to have the patient's blood pressure drop a lot. You want to tell them direction. So nitroglyceride is put under the tongue, sublingual it's called, under the tongue. So what they do is that when they have chest pain, they take one. If the pain is not relieved, they call 911 and take another one. You can take up to 3 doses, 5 minutes apart. It's heat and light sensitive, so you want to keep it away from the stove and stuff like that. And something that's normal, it's a normal reaction to have tingling sensation under the tongue after you take the nitroglyceride. Okay, so now we go on to diuretics. Diuretics, I guess I put the vasodilator on. So I already just said about nitroglycerides on the other slide, so ignore that. Diuretics. Diuretics, there are different types. You have the loop diuretics, potassium sparing, thiazide, and asthmatic. The loop diuretics includes Lasix, which is furosemide, and this is used like for people who have a lot of fluid, like congestive heart failure, someone who has edema. And the main thing you want to watch out, first of all, it could cause ototoxicity. Second of all, it could cause it could cause potassium. So you could use a potassium sparing diuretics for someone who has low potassium, and that includes spirolactone. A different type of diuretic is thiazide, hydrochlorothiazide, which is usually only used for hypertension. And you have the asthmatic diuretic, which is called mannitol, which is used for increased ICP, intracranial pressure. With all the diuretics, basically what they're doing is making you pee out fluid. So you're retaining, they're making you pee out. So it's going to lower the blood pressure. You also have risk for hypertension, and so don't give it if the patient has a low blood pressure. And one extra thing is that you have a fluid and electrolyte imbalance risk because they're peeing out a lot, and they could pee out potassium, they could pee out all different types of stuff, electrolytes, and you have risk for that. Question. Sildenafil, which is Viagra, is prescribed to treat a patient with erectile dysfunction. Which of the following medication would you question? Neuralgia? I shouldn't say that, but either way, nitroglyceride, multivitamins, or I don't know why it says insomnia, but either way, to take the question is that erectile dysfunction medications, like I said, should never be used with nitro because they both vasodilate. So the answer is nitroglyceride and sildenafil. Okay, so medications to use to lower cholesterol. So the main ones are statins, and they end in statins, so that's pretty easy. Rovastatin, atorvastatin, pretty easy. The main side effects for this one is it has kidney damage and rhabdomyolysis. So you want to report any signs of muscle aches, weakness, and you want them to take their CK level. You want to assess the liver function because it's metabolized through the liver. And if someone has severe liver disease, you obviously don't want to give it to them. Another class of medications are fibrates. It has fib in them, so that's pretty easy to see, like fenofibrate, etc. And they also have muscle ache as a side effect. You also have cholesterol absorption inhibitors, which are used to lower cholesterol level, and that main one is Ozempic. Okay, medications for dysrhythmia. So you have adenosine. We're not really going into much dysrhythmia because you really don't have to know this much in detail, but just know adenosine is for SVT, supraventricular tachycardia, too fast. Atropine is used for bradycardia, so when it's too slow. And amiodarone is used for VFib or unstable VTAC. Only two. And the hint for that is you see there's two O's. Only 2 times you're ever going to use amiodarone, VFib or unstable VTAC. Okay, Digoxin is another medication used for heart. It's a cardiac glycoside. Basically, just know that it increases the contractility of the heart, so how the heart is opening and closing, and it decreases the heart rate. So it's usually used in heart failure, etc. There's a therapeutic range of 0.5 to 2, and toxicity is over 2. So you want to look for signs of toxicity, which is tachycardic, heart block, GI, and visual signs. For this, you want to monitor their pulse for a minute before, and if it's below 60, you want to hold the medication. You also want to monitor potassium with this because it could cause hypokalemia. So these are just other cardiac medications that you should know that I couldn't really find like one specific category to put it under. So norepinephrine, it's a vasoconstrictor. It has risks for extravasation, which basically means that if it goes onto the skin, it could burn. You should just know the uses for epinephrine. For example, cardiac arrest is a big one. Reactions like anaphylactic reaction or severe asthma. Dopamine is an inotrope, so it's used for hypotension with someone with symptoms. Someone has symptoms, it's used. If no symptoms, you don't use it. Side effects are tachycardia and dysrhythmia. Milrinone is an inotrope also. It's actually given through IV, and it's used specifically for heart failure. And for this, they need a central line or like a line to infuse it from. It's not just going to be a regular IV, and it's going to be given in an infusion pump. Okay, so diabetic medications. So you have your oral and then your insulin. Your insulins are given subcutaneous, so in the fat, and you have your oral ones. The oral ones all have, every medication for diabetes has a risk, like I said before, if something's trying to lower it, it has a risk of going too low. So it has a risk for hypoglycemia, except for metformin, which is why it's like the gold standard. So there are different categories. You have the biguanides, which is the metformin. The thing about this that you want to know is that you don't want them to have IV contrast for 48 hours while they're taking it. And they have a low risk for hypoglycemia, like I said. The next class of medication is the sulfonylurea. For these, they end, I would just remember like 3G, so they all start with G. So glipizide, glyburide, and glimepiride. With this sulfonylurea, they react bad with alcohol. Don't use it with alcohol, and use sun protection. Next class of medications is the thiazolidine, however you pronounce that, and basically this one, just know that you should not have it with heart failure patients. Insulin. So there are all different types of insulins. You have the rapid, the short, intermediate, and the long-acting. Insulin has a huge risk for hypoglycemia, and what you should know is, I have a chart in my notes that you could go through, and basically it says like which medication it is, the onset, the peak, and the duration. So around the peak time, you want to watch out for hypoglycemia signs. For these insulins, you usually have a sliding scale. It's usually like, if the patient's blood sugar is X, then give this. Not for the long-acting, but for the short-acting ones and rapid. So if they're like 250, you give a certain amount of units, and it's a sliding scale. Immune system. So these are medications that are immunosuppressant. Number one, steroids. So steroids actually do like a ton of stuff in your body, but they mainly suppress inflammation and suppress the immune system. So you want to watch out for anything that's suppressing the immune system, like immunosuppressants or anything else like that. You want to watch out for risk of infection. So any signs of fever, redness, like stuff like that, you want to tell the provider and think of infection because they're on something that's suppressing their immune system. Steroids usually end in -one, dexamethasone, prednisone, hydrocortisone. They usually end in -one. What you want to know about steroids is that you don't really want to take them long term. You don't want to discontinue abruptly, and they affect the sugar, so they could cause hyperglycemia. So you want to report signs of like someone with too much sugar. You want to watch out with that with like a diabetic. Too much of steroids could cause Cushing syndrome. Immunosuppressants. So immunosuppressants, I wouldn't really know like each one. I haven't really seen them test them like which immunosuppressants, because those are really like a lot of times like cancer specific drugs and stuff like that that not everyone's going to be dealing with on a daily basis. What I would just know about immunosuppressants medication is that it suppresses the immune system. So you have the risk for infection, and you want to watch out with them for that. So cancer, we're not really going into much about cancer. Just a common one is tamoxifen, which is used for breast cancer, and to prevent it also. It's taken for several years. The side effects are actually like pretty much the same like menopause. Methotrexate is also a very common one. It's actually used for cancer. It's actually in the class of DMARD. It could be used for other stuff also. Side effects, teratogenic, number 1, so never give any cancer medication to a pregnant woman. Number 2, it suppresses the bone marrow and stuff like that, which is risk for infection. Now we go on to electrolytes. So these are when someone has an electrolyte imbalance. They're pretty easy because think about it. Potassium chloride, so potassium, if someone has too little potassium, you want to give it to them. Potassium should usually be given through like a central line, so no more than 10 milliequivalents per hour should be given through a regular line. It could cause phlebitis, vein irritation, so a lot of patients like that I've seen complained about it hurts them and they don't want to take it. K-exolate, I like to remember it as K, which is potassium, stands for K, so K-exolate. So it's given for patients who have too high potassium. You want to watch out for signs of hypokalemia, because like I said, the opposite could always occur. So calcium acetate or calcium carbonate is basically given for hyperphosphatemia. So phosphate and calcium have that relationship that if it's too high, the phosphorus, you want to give them calcium. Basically, if you want to know in short, is because calcium binds to phosphorus to excrete the phosphorus. So that's why. Some other like electrolyte, or I put them under this category, is filgrastim, which is basically increases white blood cell count. So if someone has a low blood cell count, it could be given to them. Or epotin, which stimulates red blood cells to be made. So it's used to treat anemia, conditions where people have low red blood cells. Question: which of the following medications does not cause hypoglycemia? Insulin lantus, beta blockers, metformin, sulfonylurea. Metformin. Like we said, metformin is the only one for a really decreased risk. Okay, so here we go on to reproductive medications. We're just going to go on really short because in the maternity video, we go on to a little bit more about OB medications. But tocolytics are used to suppress contractions. So if someone's going into contractions early or prematurely, give them tocolytics. These include terbutaline, indomethacin, magnesium sulfite, and basically what they do is that they suppress the contractions in order to give you enough time, like 2 to 7 days, so that you could give the baby steroids for their lung to mature when they come out. Uterotonics are the opposite. It increases contraction. So let's say you're inducing a woman or something like that. Oxytocin is the big one. Increases contraction. You want to watch out for too much contractions that it could do, like uterine tachysystole. So that's more than 5 contractions in 10 minutes over a half hour that you want to watch out for. Methergin is used to treat severe postpartum bleeding. And misoprostol, do you remember before that we mentioned it with GI ulcers? Like I said, it's used to cause the cervix to soften, so you don't want to use this in pregnant women unless you're specifically trying to soften the cervix. You want to watch for tachysystole for all of them. Magnesium sulfite is the last one we're going to mention. It's used for preeclampsia. So basically it's used for seizures. So preeclampsia is something you want to do before, like it's the stage before seizures. So you want to give it to them to prevent it. Clots. So these are medications used to treat clots. Anticoagulants and thrombolytics. So you should know the difference. Anticoagulants are to prevent a blood clot from forming. Thrombolytics are when you have a blood clot. So anticoagulants. Number 1, they're preventing blood clots. So they're going to thin the blood. So you want to watch out for bleeding precautions. So use special shavers, stuff like that, just bleeding precautions. They are used for people who had heart attacks in the past, strokes in the past, to thin the blood. Warfarin is a big one. With warfarin, you want to monitor the PT. Actually, I have a really good video to memorize warfarin PT and heparin PTT and stuff like that. You can watch it in my YouTube channel. So warfarin does the PT. You want to watch out. So foods, in terms of food, vitamin K food, like leafy vegetables, you could eat it, but not in excess when you're on warfarin. The antidote, so someone's like bleeding out from warfarin therapy, you want to give them as vitamin K or fentanyl. Heparin is another anticoagulant. You want to monitor the PTT with this one. The antidote for heparin is protamine sulfate. And you want to watch out for HIT with that, which is heparin-induced thrombocytopenia, which is basically like bleeding a lot. So you want to watch out for signs of that, which is petechia, like little spots on it that's going to indicate. Then thrombolytics. So thrombolytics are used, like I said, to treat an active blood clot. They all end in place. The most common one is alteplase, which is TPA. So think about it. Someone has a stroke, a blood clot, you give them TPA. It's contraindicated. That's what you should know. You should know who it's contraindicated. Contraindicated in anyone active bleeding, because you don't want them to bleed out. Recent trauma, aneurysm, AV malformation, history of hemorrhagic stroke, or uncontrolled hypertension. You should know that, just commit it to memory. You want to watch out for bleeding precautions, and it needs to be given within 4 to 6 hours of the symptoms starting. Okay, so here are medications used to treat the musculoskeletal symptoms. So biphosphonates, they all end in dronate. So alendronate, risodronate, all end in dronate. You want to take them on an empty stomach, and they're used to prevent the loss of bone density. Muscle relaxants, the main one is baclofen, cyclobenzaprine. I would just remember like the names and what they do. So basically baclofen, it relaxes the muscles. Succinylcholine and dantrolene. So succinylcholine is used to relax the muscles, like to paralyze. Like it's used to paralyze and relax the muscles. The main concern of that is malignant hypothermia, hyperthermia. If that occurs, which usually occurs in the OR, it's usually given in the OR. Very rare, give dantrolene. It's a reversal. Okay, so urinary system medications. So these are medications, okay, so we're going to start off with bedwetting. So people who bedwet, we're not talking about your toddler who's bedwetting, we're talking about someone who's wetting the bed after age that they should be toilet trained already, or they are toilet trained. What you give for them is, the main one is desmopressin, which is actually an antidiuretic. It's also used to treat like someone who's peeing too much, like DI, diabetes insipidus. You want to watch out for that is water intoxication, because they're keeping in the water. Also, antidepressant could actually be used for this. TCA, tricyclic antidepressant, is actually also used for bedwetting. The next class of urinary system medications are E5. So this is phosphodiesterase inhibitors. Like we said before, the Viagra, which is sildenafil, they all end in afil. Sildenafil, tadalafil, vardenafil, and they're all used for erectile dysfunction. But the main side effect, like we said before, was hypotension, hypo. So never use with nitrates or anything else that could lower the blood pressure. That's like the main thing you want to know about that. Alpha adrenergic blockers are used for benign prostate hyperplasia. They end in azocin. So doxazocin, taurazocin, etc. This just side effect, full risk orthostatic hypotension. Question. A patient who's taking warfarin therapy is admitted with coffee ground emesis. What's the nurse's primary action? Number 1, administer vitamin D. 2, vitamin K, protein sulfate, or calcium gluconate. I'll give you a minute. So vitamin K. Vitamin K is an antidote for warfarin. Protein sulfate is an antidote for heparin. Okay, now we go on to Parkinson and thyroid medications. So Parkinson, the main medication is carbidopa levodopa. And what you should know about this is that it doesn't stop the disease from getting worse. It just helps control the symptoms, like the shaking and stuff like that. Thyroid, so they like to ask on the level of thyroxine on the hypothyroid because that's a lot of people use it. So thyroid, you have hyperthyroid and hypothyroid. Hypothyroid, so low thyroid, is very common. Hyperthyroid is not that common. For hyperthyroid, so too much, you could give PTU, methimazole, and iodine. The only thing you want to watch out for methimazole is it could cause agranulocytosis, just like clozapine did. Only talked about it before, so you want to watch the white blood cell count. Hypothyroidism. This is what I would know. The main medication prescribed, tons of people are on it, are levothyroxine, which is Synthroid. Number one, you want to take it early in the morning, not with anything else, because it interacts with so many stuff, including food. Number two, you want to monitor the T4 TSH level. And you also want to watch, it is safe in pregnancy, it is, and you want to watch for signs of excess, like hyperthyroidism, that the dose is too high, like tachycardia, weight loss, heart palpitations, etc. The next class of medications is H1 receptor blockers and anesthetics. So H1 receptor blockers, they inhibit the effect of histamine. So basically they're an antihistamine. They usually end in "ine." Loratadine, diphenhydramine, which is Benadryl, promethazine. They're usually used for allergic reactions. Basically know that. The next one is anesthetics. So this is used to promote anesthesia or sedation. Epidural, we all know this when it comes to pregnancy. It's put in the spine in the maternity section. We'll talk about it more. But what you want to watch out for is hypotension. So usually before they give it, they'll give a bag of fluids to make the blood pressure go up so that the mom doesn't go hypotensive. So lidocaine is also used, you should just know, for like anesthetics purposes. Okay, so here are just other medications. I'm just going to go through a few slides of other medications that I couldn't fit under like a category of like cardiac or whatever. So just random medications that I'm going to tell you what it's used for and just pretty much know what it's used for at some points. Riluzole is used for ALS. That's pretty much I would know that, and just know that it slows the progression by 3 to 6 months, not curing it. Sumatriptan is used for migraines. So I like to think of it trip as in like when you have a migraine you trip on stuff, so just migraines. The next one is Danol. How do you pronounce it? Donazepam, whatever. All those ones are used, memantine, all those ones are used for Alzheimer's. The next one I would know is Zolpidem or melatonin. Just know that it's used for sleep disturbances, so insomnia, like someone who can't fall asleep. Lactulose, I would know that it's an osmotic diuretic that's actually used for constipation a lot, but also for ammonia, like high ammonia levels. Permethrin 5%, that's a cream that's used for scabies. Just know that massage it all over from head to toe, and yeah. Okay, isotretinoin. This is used for acne, for severe acne. But the big thing about this is that it never use it in pregnancy. And if you are going to use it, just regular, not in pregnancy, you need 2 forms of contraceptive, 1 month before starting it and 1 month after. And they need to sign an I pledge form because it's so dangerous to the baby if they were pregnant. Has a lot of side effects like Stevens-Johnson syndrome, photosensitivity, which is why it's really not prescribed a lot. But because of the high side effects, you have to know that. Okay, allopurinol or colchicine are used for gout. So, like an inflamed toe, that's what it's used for. The next one I would know is sulfasalazine, which is used for rheumatoid arthritis. Promethazine is used for nausea and vomiting. reading whatever you pronounce that, is myasthenia gravis. The last two are Clomid, which is clomiphene, is used for fertility medication. And the last one I would know is Capsaicin cream, which is used for like over-the-counter pain medication. Question. You have provided education to a patient about allopurinol. Which statement by the patient requires you to re-educate them about this medication? Number 1, it will help relieve inflammation and pain during an acute attack. Number 2, it's important to have regular eye exams. Number 3, I will not take large doses of vitamin C supplements, and it decreases the uric acid. So A, it's used to, I forgot to say this, but it's used to prevent attacks, not to treat acute attack. So allopurinol is to prevent attacks, not to treat. Okay, so that's the end of the medication section for the NCLEX. First of all, if you want all of this in PDF form, the link below, or visit my website and type and go to the section that says notes. My website is www.sarahrn.com. So that's SARAHRN.com. Or you could look in the description box below. Please like, subscribe, and stay tuned. And I plan on uploading all of the NCLEX-RN videos, hopefully by this week or next week. So good luck.